Hi, everyone, and welcome to the University of Nebraska at Omaha's Center for Public Affairs Research, Data and Research Series for Community Impact. We appreciate you being here with us today. We have a panel here on why so many dashboards, unlocking the power of data dashboards. And I don't know about you all, but I see a new one pop up all the time that is always really interesting and really valuable, and sort of a new way to access data. And that is exactly what this series is all about. So we wanted to put together a group of folks that are creating dashboards. They're creating dashboards for different reasons, and they're using dashboards for different reasons to help us understand what's going on with all these data dashboards. I'm going to introduce the panelists, and then they're going to talk in this order. So our panelists for today, Shonna Dorsey is the Executive Director of the Nebraska Tech Collaborative. Jeff Armitage is an epidemiologist surveillance coordinator, Nebraska Department of Health and Human Services. He's actually using data from the Population Estimates program that we talked about in our last session. Bryce Jones is a data analyst with the Rural Opportunity Office, Colorado Office of Economic Development and International Trade. Thank you, Bryce, for joining us. Bryce is have you ever been to Nebraska? That's a good question.
Only briefly.
All right. Well, thank you for joining us from Colorado. And Dorius, Ph.D., co-director of Iowa's Integrated Data System for Decision Making. Cass, have you been out to visit us before in Nebraska? Thank you. Thank you. I was on a webinar recently that Cass did, and I knew you all needed to see some of what she was working with. So I begged her to be here today. Okay. So are we ready to get this panel started with Shonna? Hi, Shonna. Thanks for being here today.
Thanks for having me.
Shonna and I have been hanging out more than probably either of us want lately because we're really working on a cool project together. Are you okay with showing the dashboard?
Oh, yeah, sure. Just as long as folks know that it's still in draft mode, we're making some edits. So
we're making lots of edits.
I know. When I say we, I mean like Josie and her crew, but yes.
Yeah. So, Shonna, I'm really interested from you about why do we need data dashboards? That's my big question.
Yeah. So I think that data is so critical to decision making, and without it, we're guessing a lot about what the trends are, especially when it comes to the tech workforce and what's happening, like where are people entering, exiting, what's the makeup of it, all of that good stuff. So I think it's just so critical for all of our upcoming initiatives that we have real data to base those decisions off of.
And so place yourself a little bit into the history of the Nebraska Tech Collaborative and sort of how you were feeling about data when you started on this journey.
Yeah, sure. So I joined the Nebraska Tech Collaborative as its executive director in January of this year. So I'm one of those boomerang folks who moved out of state and then came back. So I moved to Florida and moved back to Nebraska to run this initiative, it's been great. But when I was interviewing for the position, I remember asking with the 10,000 tech workers goal. So there's this goal that the NTC set when it was founded in 2018-19 to increase the tech workforce to 10,000 or by 10,000 by 2025. And I just was having a hard time understanding where we were or the progress we'd made toward that 10,000 number. So that was one of the things I was like, we have to take that on as one of our most important initiatives or things to get done in 2023. So then it took me down the path of looking at BLS data, Bureau of Labor Stats data, which Josie, you and I had many conversations about that early on when I was just trying to get something together, and grateful for folks who introduced us, including Sandra Redding, because I was like, this is okay, but it's not robust enough. It's not what we need. So does that answer your question? But that's kind of how we got there.
I don't want to pick on you at all, but it's a really fair starting place, right? We have goals, we want to grow, we're really interested in change, but we don't know where we are to start. And it's not because you were doing anything wrong. The data is a little confusing. And there's lots of places. So you were looking at Bureau of Labor data, which mostly reports things at the industry or business level, right? It's data about businesses. It's data about establishments where business takes place. Yet we were talking about growing the tech workforce.
Right.
Workforce is people, not businesses. And so we were looking at really different data trying to describe something in the middle, I think is fair, right? And so, right, you needed data, but how did you go from I need data to I need a data dashboard?
So I didn't, in my mind, I never had a solution really. I was just kind of like, it needs to be easy for people to understand and do something with. I think that's really the critical part because, you know, there are also many workforce trend reports out there, which are excellent. NTC has one that was just published like late last year as well. So they're super helpful, but they're kind of a snapshot point in time. And also you can't manipulate it very easily. So having something like Tableau where I can use my own views if I'm interested in a subset of the data on the screen, I think that's super helpful because maybe I know not everyone's interested in the same things I'm interested in. So it's ended up in Tableau, but I did not come in with a vision of like, it needs to be this type of solution, et cetera. So but I'm glad that's where it landed.
So we use data from the United States Census Bureau's American Community Survey that we talked about in our last session. And we also use data from United States Census Bureau and Bureau of Labor. They do this one together, the Current Population Survey. And the Current Population Survey is a smaller survey than the American Community Survey, but not small at all. Shonna, we've been talking about margins of error on our data too. The American Community Survey has 3.5 million respondents per year annually to that survey. For an example I gave in the last session, 1,500 people take a Pew Research Center poll, for example. Not that that's bad or good, and it's a very different source than the United States Census Bureau, but these are very large response surveys, unlike anything anyone else can do. So we have a lot of confidence in the data. Now, Current Population Survey is a little smaller, but it goes really deep on the workforce. I've presented at this series on the Current Population Survey before, but you mostly have to use microdata to work with it. They don't release a lot of tables. There we go. So yeah, and I mean, we don't need to spend too much time on it, but just thinking about some of the big questions you wanted answered.
So yeah, one of the big things for us, and let me scroll down here, was we want to see, it's interesting to us, I should say, to know how Nebraska compares to our neighbors for sure. Like that's very important, but then nationally, because as many of you know with tech, we don't compete with our neighbors anymore. We are competing with California, New York, wages that are definitely much different than they are in Nebraska in certain places, which makes it more competitive for the tech workforce for sure, especially with roles that can be remote, like your software engineers, cloud engineers, et cetera, folks who don't need to be in a certain space to do the work or be co-located with their peers. So this is all very interesting to us. And then also seeing the trends over time. So Josie and her team selected 2011, 16, and 21, just because there were some changes that happened over that period. And then going forward, this information will be updated on an annual basis. But that's kind of where we started with. And then on this second page, and we have many views, as you can see, but it goes through based on role and year, what type, how many people are in those positions at a certain point in time, which is also interesting. We're also interested in changes over time in the workforce numbers. So I'm trying to zoom out here. There we go. Just to show the percentage change over time between non-tech and tech. So you see that there is some growth, about 12,000, if that's my math is okay, 11,000, 12,000 people, which is good, but then it's been pretty slow since 21. And especially from 20 to 21, we had a drop in talent for many different reasons, because Nebraska, the way it works is if you do not live and work here, my understanding, Josie, correct me if this is wrong, but if you don't live and work here, you're not counted as a Nebraska worker. It's just how it works.
So yeah, the survey asks where you work and where you live. And so it can be a little, in some of the aggregate views, it can be a little difficult to discern some of this. But actually in the last session, I also showed just a quick view of that remote work brief we put together based on some questions that you all had. And what we really saw is that there's not a lot of people that live in another state that work in Nebraska and vice versa that live in Nebraska and work in another state. There's just not a lot of that going on. But in answering big questions about our workforce, that was super helpful just to know, right? There wasn't this secret group of Nebraskans that got stolen by another state, right? Our workforce is sort of who's here. Yeah, so Sandy was just asking about that too, like, is it people working remote out of state? And we just don't see that in the data at all.
Yeah. And there's just a lot of interesting things in here. Like when we think about underemployment and the tech workforce, or compared to the tech workforce, you see it more in the non-tech workforce where they might hold multiple jobs versus working one full-time. So there's a lot of opportunity from my perspective as someone who's very supportive of career changers and the potential for increased economic prosperity for Nebraskans. Yes, our high school to college pipeline is awesome through internship, job placement, amazing. But we have a lot of opportunity for career changers as well when you look at the difference. So like non-tech, working more than one job, greater percentage of those folks are in non-technical roles versus tech. And sometimes, and this is anecdotal for me at this point, we need to dig into the data a bit more, but from the tech workforce, people in the tech workforce that I know that have multiple jobs, it's because they have a side thing where they're maybe doing some web maintenance or other stuff on the side just for additional supplemental income, but it's not usually a necessary thing for them to do that. It's something they like to do. They have the skill set, they can make money doing it. So why not? And then just seeing the demographics, this is also very important to us as the NTC is wanting to impact and increase the number of women in technical roles and also the people of color that are in tech. So we have some data on this to help people see the difference and the gap. So again, that we are focusing our efforts on the right things. And then this slide, our view, I think is going to be very interesting to people as we move forward, just to see like where the salaries are. So when you look at all of our neighboring states, so I am not great with geography, admitted, but let's say it's Colorado, Iowa, South Dakota, North Dakota, and Minnesota, Kansas. I think I got them all. That's crazy. So proud of me today. But anyway, in most of those states, the salary ranges are higher for tech workers. So that again is going, I hope it informs decisions about what we need to do as we're competing. Because again, now it's not like California, which we talk about a lot, especially Silicon Valley jobs in the past, remote, have really like the salaries are just outside the range of what's typical in Nebraska. But now you have our neighboring states that are also introducing some competition. So anyway, I can stop sharing there, but the point of all of this is that we want to use the data or use good data for us to make better decisions about what initiatives we recommend for our partners. So
awesome, Shonna. Thank you so much. You can stop sharing. Keep that around without the URL on it. So if we want to bring it back up, we can do that. Jeff, if you want to pop up and get your screen share ready. A couple questions came in. Michael O'Hara asking a little bit more about that remote work. Yes, I will send you the brief we did on that so that you can see what we have in terms of detail for how people live and work. Someone asked, can you get the data directly from the Census Bureau into Tableau? There are a range of APIs because we're using two different sources and the data is really large coming out of the Census Bureau microdata. It really needs to be summarized for Tableau. We did not use the APIs. We were also grouping things and got to make a lot of choices when presenting data. And so sometimes it just doesn't work as cleanly as just hitting that API button. Someone else asked, do you use Tableau Cloud Server or other? How did you choose that Tableau version? We are using the Tableau desktop for building, Tableau server for hosting. We will eventually embed that directly on Shonna's page. In terms of Tableau version, I always download the newest one. Okay, Jeff, Thank you so much for being with us and just working on an amazing project. And I just thank the state of Nebraska for having Jeff around to do things like this. So thanks for coming on. I'm going to turn it over to you.
All right. No, I appreciate it. Yeah, thanks for having me. Good morning, everyone. I am excited to share what we're doing with what's called Nebraska Public Health Atlas in our state. And what I've got here is really just kind of some bullet points to go through our experience and our journey for the most part, and can kind of show quickly we don't have a lot out to the public yet. We're working on a lot. So I'll kind of just explain our process and how we are, where we are today. So real quickly, what is Atlas? It is the Division of Public Health at Nebraska DHHS. It is the data visualization platform. So it's what we're using to work towards getting our public health data out to the public and other partners. And the goal, I think, with all of this is that you're giving people greater access. It's easy to use, it's interactive, it's web-based. And so real quickly, what are we working on? We have the Behavioral Risk Factor Surveillance System, or BRCAS dashboard out. That's an adult telephone health survey. We have a fairly simple respiratory illness dashboard out at this time. We have a few in review. We've got a vital statistics leading cause of death dashboard, drug overdose dashboard, and working on updates to our BRCAS dashboard. And then in that in-development stage, so things we've actually started building would be a health equity dashboard. And so, as Josie mentioned, we're using population estimates. We've put a population demographics dashboard together that we're finishing up using that data, and are looking at social determinants of health with ACS. So we're excited about where that work's going. We've got a vital statistics birth dashboard we're working on, some additional components of the death dashboard, and a more expansive version of respiratory illness. And then in the future, we're looking at environmental public health tracking, planning, and maybe development here later this year. So a lot going on right now in our model. So why data dashboards, I think, was the question that we were faced with. And it was more of, I think we hit that point where we couldn't say no, then we just wanted to say yes. We were not far, but we were, getting behind the curve of where some states were, and we just knew we needed to get out of the old, long narrative, very burdensome report development world and into something that puts it in the hands of the users. And so the benefits to us as we thought through that, it's helping us meet our partner needs. We own a lot of data at DHHS, and we haven't always done a great job of getting it out, and we think this will help us get it out. It's more efficient, it's a better use of our technology. And when we think about staffing and staff turnover and burdens like data requests that come in regularly for us, this will certainly help relieve some of the pressure on that. And ultimately, it provides quick and easy data for planning and decision making, which is better public health practice. And that's why we're doing what we're doing. You can see the 10 essential public health services on the right. Assessment is the foundation of public health, and without having a good foundation of accessible data, it makes it really hard to be successful and to move forward. And so the question then was, okay, we're going to do this. Where do we start? What do we focus on? And we did ask a lot of partners, including our local health departments, so what do they need? What do they think would be most useful? So we used that. But there were also many other factors that we had to think through as we really got down to kind of a granular level. Of course, what's the importance and value of public health practice is an important piece. But then what's that availability and structure of the data? What's the back end look like? Is this data we own? Is this data we have to get from somewhere else? Can we get it regularly? Is it something that's annual in a flat file? Is it something that's real time? Do we have the electronic feeds? Do we have the infrastructure in place? It's great to want to build a dashboard, but if you don't have the back end data structure in place, it's really, really difficult. And so we had to think through that as a starting point decision as well. And having that committed data owner, having somebody in the organization who understands it is great, but if they can't really commit the time to helping think through that granular level detail about this means this, and this is what you want to use, and this is the structure of it. So we wanted to make sure that we had that, and of course built that capacity over time. A couple other factors. What was the scope? We thought through, single source versus multi-source. An example of that would be like the behavioral risk factor surveillance system or vital statistics data as a single source. But there's a need for multi-source dashboards. So if, a cancer program says, we really want a statewide cancer dashboard, that would be incredibly valuable. There might be 10 data sources in that. And that's it's a much more challenging, I guess, point to start and to try to build with that. So for us, as I mentioned here at the bottom, we focused on single source as a starting point. But then we also wanted to make sure it had granularity. What do you need in the data you're reporting? For us, we needed demographic breakdowns, geographic differences, trends over time. That was important to us. And I think depending on the organization, there's, of course, a different answer to that. And what about our lessons learned? It's been an interesting few years of getting this up and going. Establishing data governance up front, I think, is critical. There's so much that encompasses data governance from, what does the environment look like? What is the tools and technology and software systems look like that you have access to or that you need? Being able to sort of define the need in that kind of needs assessment and business requirements and functional requirements, and then really building that system and so you have that foundation in place. And all the rules and so forth for actually reporting the data and getting it out. I mentioned that backend data structure is an important piece. One of those is the manual processes. The more you can move to automation, I think the better. We've had a pretty manual focus for a long time. We've had a lot of great data and really smart people using it, but it's been very siloed. And so excited to be working towards more automation in our environment. Having that executive level commitment being critical, everybody at every level in the organization needs to be on board if they're really moving forward with an enterprise-wide business intelligence solution, which is maybe a little bit different than a single dashboard, but building that and having that support allows that whole system to flourish and move forward. Those, needs and potential solutions early. We, unfortunately, I guess you could look at it this way, purchased a solution to build dashboards. And then I know you said you were going to ask this, Josie. And so we had acquired Logi Analytics. It was a great tool. It was very embeddable. We didn't have a really embeddable environment that we worked in. And we built a dashboard and we released it. And then as part of that broader data governance infrastructure building, the agency said, we're going to move forward with Tableau as sort of our primary enterprise business intelligence solution. And so it took us some time, we were building a staff and training and had to kind of redirect it out. I think it'll be better in the long run, but avoiding those things is certainly helpful. Blending product business and business owners with the IT team, I think, is critical. You've got to have that technical knowledge, but you've got to have the knowledge on the business, or in our case, the public health side, I think, to bring together more than just a meeting a week, as I mentioned there, I think is critical. And it's taken us longer than we think, I would guess. That's probably the experience of most. It sounds simple on the surface, but it really does take quite a bit to get it up and running. But we've seen some early success, which we're really excited about. We've been able to decrease data requests for purpose since the dashboard's out. People are excited, for future releases, and we've got a system that is much more modern and sustainable over time, and I think is going to be around for a very long time. And I guess real quickly on our homepage, and I know I'm probably up on time here, Josie. This is our Atlas homepage, and I think in the slides that come out, the address is there on the last page. We don't have a lot here yet, as I mentioned, but we got a lot happening and a lot more is coming. And the behavioral risk factor surveillance system dashboard is here. It's got, documentation and background within it for all the methods and so forth, tips on how to use the dashboard, and a lot of information, demographic breakdowns and trends, and geographic breakdowns within the state for many self-reported health issues in the U.S. So I'll pause there, I guess, before digging in.
That was perfect. Thank you so much for sharing it with us too. And so just to summarize something you said, and someone asked about in the last session as well, births and deaths data, right? You all have been collecting that. And where did it live before it would live in a dashboard?
Yeah, it was in, recently it's in a database. We create what we call annual end of year files, where we have to cut off a collection date for submitting it to the feds, and then that's what we use for reporting. But it just sat in a file that people would bring into SAS and analyze to fill requests, but it never lived in an environment that was accessible by those who didn't have the training and understanding of statistical analysis.
Absolutely. And that's what is so cool about what you're doing. Will the very basic public information in the vital statistics report up to 2016 be available anytime soon? So honestly, good question. Like, how are you both going forward and back in time with your dashboard?
Yeah. So yeah, we will be moving forward with our vitals data. It will include some of the historical data in there. We'll be going back to 2005 with that dashboard. So the 2005 to present. And then we'll, continue to add recent data as we move forward. And it will be, there's some reporting still happening. I know if it's a legal requirement, but this will be replacing annual reporting that we had historically done back to that 2016 report that was referenced in a more interactive dashboard format. So that will be a change, kind of a permanent change in direction in this point.
Wonderful. Next, I want to bring up Bryce Jones from Colorado Department of Economic Development. And I found your dashboard online. And I was like, oh, we're going to be really interested for a couple different reasons. But I'll turn it over to you to kind of kick us off and talk about it. And we'll follow up.
Sounds good. So good morning, everyone. Just sharing my screen here. Trying to get to presentation mode. All right. So good morning, everyone. My name is Bryce Jones, and I'm the EDA data analyst for the Rural Opportunity Office within the Office of Economic Development and International Trade. So for my current work at OEdit is to lead the state side of on data of two of our economic development agency grants. The first being a statewide rural economic resilience planning program, the Colorado Rural Resiliency and Recovery Roadmaps program, which is comprised of 16 regional teams made up of over 100 rural communities. And the second program I primarily engage with is a statewide comprehensive economic development strategy, the development thereof. And alongside that, I engage in other research, interagency projects, and assistance to rural economic developers. And out of this economic resilience planning program, in engagement with local economic rural developers, I found there was an expressed need for sort of a one-stop shop for data needed to aid in pursuing funding for economic development initiatives. And so when I created my dashboard, the primary users of the dashboard that I kept in mind were rural economic developers, or those who fulfill economic development roles in rural communities if an economic development office doesn't exist, such as chambers of commerce. There are other users I kept in mind as well in the development of the dashboard, including state partners who could need rural data for pursuing grant opportunities, and for university partners who are looking for a one-stop shop on economic rural data that could be available. So for the rural data dashboard itself, since the primary user in mind is not necessarily an expert on economic data, I tried to the best of my capacity to provide a dashboard as clear and readable as possible. And of course, some challenges arose in this, such as titles for tabs, of the dashboard being abbreviated and based on data source and not being as descriptive as potentially possible when selecting the tab for the dashboard you want to select. And this is a choice I kind of had to make to ensure that the user could understand what was on the tab that they were selecting, since there is a sort of a character cap on the tabs for the dashboard. So to kind of help overcome some of these potential barriers to engagement, readability, and understanding of the dashboard for maybe a more lay audience, there are a few things I did to help kind of assist in that. The first in which is I created a rural data dashboard 101 document that identifies all sourcing within the data dashboard and all definitions. And so the user can go in there to see where I'm pulling from for each of the pages, as well as what it might actually be saying. So for those who might not understand, what exactly being part of the labor force thinks, for example, for local area unemployment statistics, what employment specifically is, or what's the difference between an LLC and an LLP, for example, that can all be found within the 101 document to help the user kind of understand what is in there. And second, through our office, we offer a rural technical assistance program. This program provides free coursework through an online learning management software, Thinkific, that provides courses such as Economic Development 101. And this rural technical assistance program helps our especially rural economic development organizations who may not have the capital, capacity, or experience to engage in other professional development work, and can also allow new economic developers a free introductory course into economic development and also into navigating my broader office, the Office of Economic Development and International Trade, as the ROO, Rural Opportunity Office, is just one of many offices within OEdit. So to circle back to the dashboard on this, through this free LMS software, I created a course specifically on the rural data dashboard that's free for users to join, that can also walk them through how to engage with the dashboard and how to move on through it. And finally, I also offer bi-weekly data office hours that are open to the public and free to join, where economic developers and other interested parties can get one-on-one time with me to go into specific data asks that they might have for their region or questions that they might have about the dashboard itself. So the development of this dashboard itself pulls from a really broad array of data resources, because it is trying to serve as that one-stop shop. So I pull from a whole lot of state and federal resources when I read in. So first off, in the creation of the dashboard itself, I use Tableau and I use Excel to read off of Tableau. I don't use any APIs. I'll get into that when I start talking about the state data that I have to read for. So I use Tableau because I think it's a really easy to use software from like the developer side to do dynamic and very expressive visualizations, especially around mapping. And I use Excel as well, just because it's what I'm most familiar with to read off of. There are pros and cons of that I'll start getting into as well with the state data. But for the tools I use to gather the data for the dashboard itself, I utilize one is called the Colorado Labor Market Information Gateway. This is a tool created by our state's Department of Labor and Employment that collects BLS data and some other data resources as well. This is where I specifically go to get the BLS data, because the downloadable format that it just produces out for a user end is just a lot easier than going directly to BLS. So I just use our state resources. I also utilize quarterly workforce indicators from the census within my data dashboard to try and get to some of that more pointed, I would say, data from the census on industry trends and the like, especially for rural communities. And I use the Census Longitudinal Employer Household Dynamics Extraction tool. A bit of a mouthful, but this is a really fantastic extraction tool if you want to get to QWI information. It filters information really in a user-friendly manner. And if you're doing something very bulk, it can also email the results to you as well if you're going over a long range of time. The QWI is a panel data source. It essentially gathers a lot of information from a lot of different census and some other state as well resources to combine into like individual and business level data. And so there's a lot of information in the QWI. So one reason as well is I use Excel for the back end of the data dashboard. it is a large document. And when I start getting into especially the business entity filing data is one of the challenges with the data dashboard moving forward. The other data resource I use to get Department of Revenue and Secretary of State data in Colorado is our Colorado Information Marketplace. For the data savvy people in Colorado, this is kind of where you go to get state data. It's just essentially a holding site for all publicly available state data that we can download across various different departments within the state of Colorado. And so that's where I get business entity filing data and our Department of Revenue data. And the final tool I use, which I'll talk about with the Secretary of State data, is around the business entity filing data within the dashboard. So for the data dashboard, one of the most unique aspects of it is that I have found from 2015 to present all business entity filings within the state of Colorado that have a principal address there and have matched them to their respective county. So this allows economic developers and other interested parties to look at business entity filing trends by type and formation date at the county level. But to do it at the county level, I have to use the census batch geocoder tool, because in the raw data itself, it'll have city and it'll have state and it'll have zip, but it won't have county. And for some of our areas where we have multi-county cities, for example, I have to use the census batch geocoder tool to process through that. So in short, one of the challenges that's entertaining with this on the back end is that for the business entity filing, there are thousands of entity filings a day, and I update this data dashboard quarterly. And so I have to do that cap from 2015 to present, just because the quantity of entity filings just starts to get too large to even handle in Excel. Excel has about, I think, a little over 1 million row cap. And I'm soon going to have to adjust it to 2016, the present for entity filing data, simply because on the back end, Excel is just getting full. So one of the other challenges as well with the dashboard for our for sharing data with some of our rural partners is I ensure to try and share a more filtered version and a tailored version to our rural partners, just because the Excel sheet itself it reads off of is about a gigabyte at this point. And so for those with like slow bandwidth, meter data, et cetera, I try to provide more tailored versions of the back end of the dashboard for them, so that they, if they're in a rural community, they don't have to get all the Denver data. And I'll show a couple examples as well, because I kind of got talking and I forgot to show these couple slides. But this is an example of the view of the business entity filing data. So as you can see, you can adjust by the year to see statewide all the various entity filing trends. And below is a line graph as well, where you can see by entity status from 2015 to 2021 in this view at a county level. How are those businesses doing? So for the 2015, you would see for those who filed in 2015, how many are still in good standing? How many are delinquent? How many have voluntarily withdrawn, et cetera? And then for the census data here's an example I have of a table utilizing the quarterly workforce indicator data. One thing I forgot to mention is that this data set I utilize as well lets you get some more demographic characteristics as well that might be needed in other data resources. So for those who might be interested in specifically pursuing economic development and workforce development initiatives centered around, let's say, engaging like young women in a certain industry, this could be a tool to help like express the need for that. And one of the benefits and challenges of this, of course, is sometimes for very rural communities, the values can be null or muted just because of privacy concerns or not being able to meet census level standards of data quality. But for those, I have to then consult either utilizing other data resources, unfortunately, maybe having to use a paid service such as something through like Lightcast, or having to engage in primary research. So with that ends my presentation, and thank you.
Can you show us the dashboard, one of the dashboards? I know you have a couple. I discovered the rural, but just to click on it, the wealth of information available.
Yeah, can do. So
yeah, me particularly excited.
So yeah, so this is the dashboard itself. So it's going to load for a minute here, but here is just the county view as well. Right now on our webpage, I have a county version. I have one just by our economic development districts, and I have one specifically for those teams involved in our roadmaps program. That roadmaps program actually is one I'm going to here soon be replacing with one instead for our SBDC districts as well to get more data for them. But yeah, so this is the one that has our local area unemployment statistics and our sales. So here would be like gross sales, retail sales that you can track on a monthly basis as well, with labor force information, unemployment rate, month over month changes, year over year changes. Here's that business entity filing page that I showed in the presentation that lets you look at the quantity of entities formed, their status, filter by entity type as well, which, nope, that's status. Which, as you can see, there are quite a few different forms of entity type. So if you're, for example, interested in cooperatives in rural Colorado, you could utilize this filter selection tool to specifically look at cooperatives, which is also why I really like Tableau as a data visualization tool, is just because it lets you get to those filtered views in a very user-friendly manner.
That's awesome. We're gonna probably want to talk a lot more about this. So much great data and how you've blended the different sources. Such a great use. All of the data that you have in here is available in Nebraska, but I don't know of any resource that has blended it as extensively as you have to date. So that's exactly why I wanted to have you here. But now I'd love to have Cass jump up from Colorado to Iowa. We're going both sides. Thank you. Thanks, Bryce. If you'll stop share when you get a chance. Awesome, Cass. Thanks for joining us.
Yeah, I am so excited to be here. And Josie, you may not be thanking me in a minute because I know that you brought me here to talk about our integrated data system for decision making, which is I2D2. But as I was thinking about the goal of this project, which is really how do you drive community impact with data dashboards, I want to talk to you about a slightly different project. So, you know, my team has probably created, I was trying to count while we were doing this, but over a dozen dashboards in the last 3 years. And every dashboard is really different depending on who our client or sponsor or the end user will be. And so the way that we drive impact is one of the things I've been focusing a lot of my time on is developing a human-centered design approach to dashboard design. So that's what I want to chat about. And the example I'm going to give is Recovery Iowa. This was created because 5 years ago, Iowa was one of only 5 states in the whole country that didn't have a recovery community center network. And our state Department of Public Health said, we need one, but we don't know where to get started. So I'm going to talk through that process. And we knew that at the end of it, they wanted a dashboard. But it was this very long data collection process to get to that dashboard. And that dashboard is for local community groups and people in crisis. So people who have a substance use disorder who need to know where a meeting is right now, a peer support meeting like AA or NA, where did they go? We also have a dashboard for them. So creating a dashboard for someone in crisis is quite different than creating a dashboard for someone who's at the state and wants to be using the materials, as well as the community groups that are largely run by people with a high school degree or some college. So in each of those steps, we had to think about it quite differently. So let me talk about the process for how we think about this stuff. I'm going to share my screen here. So this is me. This is Iowa State. Please come visit. We love people, although it's very hot right now. Wait a week or two. So I'm going to talk about human-centered design, quickly give a couple of case studies. And then if you fall asleep or miss it, the big point is engage people in the process. Engage them at the beginning, engage them at the end, engage them throughout. That's the way that we found we can drive the most impact with the data products that we create. So I am also the director of the Public Science Collaborative, which is a science consulting shop for governments, state and local governments. And the principal partner that we're going to be talking about is the Department of Health and Human Services. So excuse the transition. Let me give Health and Human Services the credit they deserve. Okay, there's their logo, and we can move on. This is our guiding principle, the human-centered design. This is design thinking. And really the first step, the most important step, is that we empathize. So who is the final user of our product? What are their needs? What do they want? How do they feel? We get way down in the deep. We build personas that say things like, Jim is a father of 3 who really loves to watch football on the weekend. And, you know, we like give full examples of their jobs, their education, their social media uses, who are the likely users, and we put a face on that. And that helps us to define the problem. So when you're building a dashboard for Jim, where he works and what he needs and his educational background will help us think about what are the buttons that we should put on there? How easy should they be to access? What are the resources and tools that Jim or Sarah or whomever will want to use? So empathizing helps us really define the problem of what we're trying to create. And then we ideate, we brainstorm, and we prototype. And then we test that model. And this is a very iterative process as we're coming back through. So I'm going to walk you through a couple of case studies so you can see what I mean in this process. But really, it begins with people. So in the first example, I'm going to talk about one of the projects that we've taken on, which is we helped the state develop their first overdose surveillance dashboard. And this was with the Department of Public Health, which has now merged with Health and Human Services. And we did this in coordination with a Linkage to Care Advisory Group. So this had folks from public health, it had hospital administrators, it had the governor's office, there were academics from all of the Regent's universities involved, there were people representing the sheriff's offices, treatment centers, prevention centers. So it was quite a large group. And we facilitated 2 years of conversations with them. And this is sort of the outline of those conversations. So in our first conversation, we did stakeholder mapping. Who are the people that need to be involved through this process? Who are the end users? Who are the people that we need to keep informed? Who are critical partners? And then we really thought about who are those. When I said those end users, we developed those personas. Then the next time we met, we said, well, what kind of experience do we want these people to have when they come to the dashboard? What is the personality, the language, the tone? What's the purpose? Why are we doing this? And what is that, experiential element? And then we really wanted to solidify what was the vision and mission of this dashboard and of all the people who are working on it, because that's it helps you simplify your decisions later. When you're like, should I do this and this? Should I add all these extra data elements? You say, well, is it part of the vision and mission? Does it really help move forward what you're trying to move forward? And then we held our data discovery workshop pretty late in the day, you might think, to get to data. And this is where we're saying, what are your data holdings? What other data holdings do we need to bring in? We reviewed 25 other state dashboards, kind of tore them apart, what we loved, what we didn't like, what we want to see. And then just like was shared earlier, we focused on governance. Some of this data is proprietary, some of it's behind legal paywalls. What do we need to do to make sure that we have the governance in place to make this work? So this was the process. And then at the end of it, we were able to create what I think is a great dashboard. But it started with people. Now, in this case, we didn't go out and interview. My next example will have interviewed people. But here what we did was the team, all the people involved said this is who they thought the most likely users of the system were. So we have a proposal writer, we have a community coalition leader, we have a state administrator, Diana, the decision maker, and we have a healthcare administrator. And each of these had distinct needs that they needed fulfilled when using the dashboard. And so each of these needs, for every page on the dashboard that we created, for every data element, we went through and said, does this meet the need of Pete? Does it meet the need of Charlie? Does it meet the need of Diana? Or does it meet the need of Helen? Or all of them? But if it didn't meet anyone's needs, it was removed from the dashboard because we wanted this to be a user-driven sort of experience. And I said, you prototype and then you build. So we prototyped everything in R, and then they said, great, we love it, move it to Tableau. And we built the whole dashboard in Tableau. And then there was a realignment of the state government, and public health got pulled into Health and Human Services, and Health and Human Services said, just kidding, we do everything in Power BI. So this question about what is your framework, we found that we are shifting what we prototype and produce in based on what the people that we're working with really need, what our partners need. So this was a great example. But what was really cool is after the merger happened, this was the first data dashboard that the new entity of Health and Human Services created. And they did it because it was human-centered. And they felt like, we're going to start here, we're going to make this our showcase, and then we'll move on to the other ones. The second one was much more complicated. So I'm going to kind of water ski over what we did, but I want you to just get a sense of that was a pretty fast project. I mean, we did workshops that took over time, but the actual dashboard build was not as difficult, although it's lengthy. The next project's one that took about 5 years to do. So if you have time, and this is one where the state was trying to build both a physical infrastructure and an online infrastructure because there was no recovery support services. Our state code provided for treatment and prevention, but not recovery. And so this has included changes to state code, changes to the names and organizations within the Bureau of Substance Use, and creating an entity called Recovery Iowa, which my team maintains the website for. So public health came to us and said, we need recovery community centers. Iowa doesn't have them. Almost everywhere else in the nation does. What do we need to know to be successful? And so our human-centered design this time was we went out and interviewed 43 people with lived experience, in-depth interviews. A couple of times we went back and did multiple interviews, and we asked them what their experience was. We asked them what they needed, and we asked them what advice they had for building recovery in the state. And we're data scientists. So we also listened and read through these transcripts and said, okay, so this person dropped out of school and needs workforce support. And this one's a vet and needs to connect with VA. So as we're building a dashboard, we want to know things about education. We want to know things about the drug drop-off sites. We want to know things about workforce development sites. We want to know things about veterans resources, for example. And then we went and asked national leaders. What's that? No, okay. And then we went and asked national leaders for advice. We went and talked with 28 folks from 28 different states and got their advice on what they would do to build a framework here in Iowa. And along the way, we said, what resources do local communities need to build this RCC? And again, we did this with our data hat on, because as they started telling us the things that the local resources that they wanted to connect people to who were in recovery, we knew we needed to start measuring those things for the state. And then so then the state came to us and said, okay, how do we know if a community is recovery ready to build these recovery centers? And so we made a recovery ready community index. And our first index included about 16,000 elements that we collected from around the state on things like hospitals, rural health clinics, libraries, parks, churches, sober living houses, mutual aid meetings, childcare, all of the things that we heard were important to sustaining this healthy living for people who are going through recovery. Here's a better slide. You can see all of that. And we mapped that. And then we created an index where we weighted things differently and measured the breadth and depth and size and culture of recovery in our state. And we identified the top 30 communities in our state that had the resources that they could leverage to hit the ground running with an infusion of funds from our state partners. And so the state put out an RFP to fund these communities. We did community engagement across the state, but 4 of the final communities were selected from an independent audit system. And they happened to be 4 of our top 5 communities on who was recovery ready. They opened their doors 1 year ago, almost exactly, celebration time. We're super thrilled about it. And along the way, we've been providing them resources. So we took all of that information that we've been collecting to build our dashboard, and we created community reports. We gave those reports to each of those 4 communities. They started sharing them around. Suddenly people were asking us for more. After we got 30 requests, we called the Department of Public Health and said, we should just make these reports for everyone. So we ended up making all of the reports, which you can go and use the dashboard, but people love reports too. So we made a report for 275 communities in Iowa. That's every community with more than 750 people that outline all of the resources that are available to them in their community. We also took all of the information people had shared through those interviewing processes. If they said like, oh, I have this really cool form or advice or whatever, and we pulled it together and put it on a learning management system that we shared back with the communities so they could sort of track that technical assistance. But then what you care about is we had all of this mountain of data left, and we moved it into the sort of statistical product that you might be imagining from the beginning. And this is on our Recovery Iowa website. let me back up just one and say this includes things in addition to the quantitative data, we brought in those stories of recovery from the people we'd interviewed and the tips for recovery for other people. So those can all be found on the website. But this is really the heart and soul of the website. So we have recovery resources. Now, this looks messy, and wait till you see the next one, even messier. And that's because all of the resources are selected, but you can select one or two, and you can see at the top, you can go there, put in a search button and say, I only want to look at AIMS, and I only want to look at recovery housing options in my area. And then it will find those and provide you information on the side. The same thing for the general well-being resources, whether that's homeless shelters, intimate partner violence programs, Section 8 housing, YMCAs, playgrounds, the things people want to connect to support their health. You can find that on the tool. Now, this is again when everything was selected. But because we were human-centered, we learned through the process that one of the things that was not available that people really needed wasn't just this data. They needed to know where they could go for peer support meetings. So at the time we started this project, the Department of Public Health had a listing of about 20 to 25 peer support meetings on their main website. And so if I was a person in recovery and I needed to go get a meeting, I would have to go to that list, click on them one by one, search for meetings, find one near me. That really doesn't work for people in crisis. So we wondered, how can we help people build this better? And we created a program. So we go and scrape all of those 20, 25 websites every day. We clean it. It gets coded. It gets put onto a map. You come in, here's our app. If you need to find a meeting, yes, you can choose. You can see up here what type of meeting, whether it's online or in person, what day you want it, what time you want it, and what location in the state you want it. And it works great on your phone. And so this was one of the things that we learned through the process that people needed that wasn't even on the radar of our state partners. And so I think it's a great example of what I'll say our takeaway is, which is start with people. You'll be surprised what you come up with. What we found was we knew that the state needed data resources. They wanted their public health infrastructure, their system of care mapped, but they didn't know what that would include. So we asked real people. And then we asked leaders around the country. And then we asked leaders within our state. And then we took these results back to them and asked us, what did we get right and what are we missing? And so engaging people through that process, then we also found a whole nother type of data dashboard that they needed, such as the peer support meetings. So that's examples of, how you can start a process, and it can just take you in all sorts of ways. And we're currently now building data infrastructures for each of those 4 community groups that helps them track all of the people who come through their doors, and so they can manage and evaluate their own success to get future funding.
Well, thank you so much. Thanks all the panelists for their presentation. I'll just ask that they come back on camera. Folks, get your questions in. The genius of this group is kind of marveling me right now. I'm going to ask a question to start. So all of you at some point mentioned stakeholders, users as being important to your systems, right? Into creating your systems. I'm going to ask, do you have a positive and a negative about using them? I'm sure you all have a positive, but I want to be fair. Integrating stakeholders into data-heavy, tech-heavy systems is also hard. So can we round robin on a positive about engaging users and stakeholders in your data dashboard and a negative? Cass, you want to start us off? You just gave us some great positives.
Yeah. So, we tend to work with government, which means everything we do is also politicized, which means there are lots of very interesting road bumps along the way, including one of the dashboards we created. We had legal agreements in place for 2 years before the end of our contract close, and they were never delivered on, which is not abnormal. That's happened in other projects. So we ended up having to go and find public data to replace all of the private holdings to even meet the deadline. So the people that wanted it were the people who owned the data, who gave us the legal agreements, who then for political reasons couldn't give us the data, but we still had to produce the result. And so we had to go find public data and bring it in. And one of it was downloading to JEPS. We got some BRFIS data that we pulled in. And the way that we pulled in the public data was still too fine-grained to meet our state standard, and so we had to mask the public data, and it blocked out a huge portion of our map in terms of the number of people per county. So sometimes, level of granularity matters and working through that. But that of just being like, wow, this is public data. I can't believe we have to mask public data to meet the standard after going through all these roadblocks was sort of a, interesting process. So partnering with resistance is a continuous part of the game.
That's a nice way to say it. Bryce, what do you think? Positive and
Yeah,
negative?
one of the positives definitely has been for some of our rural economic development organizations who might not have like the funding to be able to afford like a subscription to a data service such as something like Lightcast. The rural data dashboard served as a really great tool to help them in a lot of their economic development initiatives and pursue funding opportunities that are data informed and data driven. I've also seen a lot of like benefit out of that, where through the creation of the dashboard, the data isn't just there to check off a box, but a lot more economic development initiatives are being more inspired and led by insights gained from the utilization of the data dashboard tool. But still, one of the downsides of it can be for some of our very rural communities where there's just still, a significant amount of muting of the data. For them, it requires a little bit more extra legwork, and also one of the challenges as well can also just be, again, that just size of download too on the back end to try and, for them to get the data themselves can sometimes be a barrier that requires some coordination.
Jeff, what do you think about stakeholders?
Yeah, no. I mean, the value is that it helps ensure we're delivering something that's actually wanted. And I think that far outweighs the negatives of including them. But yes, I mean, there's a lot of different ideas, both on what should be built and how it should look and how it should function. And we've experienced that at some point, you just have to make a decision, and not everybody's going to be happy with it. But to Cass's point, we can't, being a government entity, we can't always deliver what's wanted and needed. So it's that balance of having to explain that and be able to get out what we can, but it may not be everything that everyone needs.
Are you with us? Thanks, Jeff.
Yes, I am, just off camera.
Okay, no problem. Do you have a positive and a negative about working with stakeholders?
Yeah, I do.
Dashboard, go for it.
Definitely. So more positives, I think, but one thing that is challenging, I should say, since we're still in the middle of this project, is just making sure that people have the opportunity to provide input, but also that we kind of keep it pretty clear that while we are open to it, we can't accept all changes, and it's a balancing act. So I think that's been the hardest thing, and it'll be interesting to see what happens once we release it live, what additional feedback we get. So that's on the negative side, but I would say definitely more positives. Just having that engagement will support buy-in long-term. So that's just been excellent from my perspective. And Josie, I don't know what your thoughts are since you're partnering with me on this, but that's what I think.
It's a joy. No, I just wanted to point out right, and Cass, I think you did a great job, right? The impact is much greater when we build with the user in mind. 100%, right? Because what I think is interesting and what everybody else thinks is interesting are different. And I think that's a wonderful aspect of the world we live in, but I can't sit alone in a room and build something that means something for everybody else. So we need that feedback. But there is, there are politics involved, there's move forwardness, there's a level of data knowledge usually that the builder has that a lot of the users don't have, and that can be a challenge too. So there's lots of challenge, but the payoff is always there. Someone did ask when the Nebraska Tech dashboard will be available. What is our scheduled time frame ish? And they put the ish, and I appreciate the
Yeah, September 7th is our plan. I will drop a link here shortly to an event where we will release it. It's September 7th at the Data Center, 1623 Farnham, which is fitting since we're releasing a data dashboard. So anyway, I'll put that in the link, but I'm sorry, in the chat, but September 7th.
So we talked a little bit about our stacks, and this is not a Tableau conference. We are not promoting Tableau. There's lots of different tools out there. But I'm really interested in some of the challenges in switching. So I think Cass and Jeff, you both mentioned having to switch. So how are the tools maybe alike or similar? What are some of the things to think about when you have to hop around? And I think that happens a lot, right? If UNO said tomorrow, we're not buying a Tableau license, I'd have to switch. So Jeff, you want to kick that one off?
Yeah, absolutely. And I didn't mention that we're still doing some things with the tool called ArcGIS dashboards. And so we've got a very strong capacity to use ArcGIS, and it's kind of a blend. So I think we're trying to think of what's the use case and what's the best tool we should use to deliver that. We are a Tableau agency in terms of the Atlas initiative moving forward, but recognizing that there might be instances where we really need to find an alternative. But I guess more directly to the question, for us, we have, which was interesting on the tech presentation, we have a lot of contract staff who work virtually from other states. And when you bring someone on, you look for the skills and that you need. And so we've now been able to hire Tableau developers who come in with that experience. And hopping to something else, you have to step back and go, okay, do we have the right team? Do we have the right knowledge and training? If we have the right people, we need to get them trained on another tool. And that can be fairly smooth, but there's always, the work of the redesign and the rebuild and the connections and the knowledge of the existing teams. So.
Yeah, this is something that we've worked with a lot. And I'll just, coming a slightly higher level with my professor hat on, is I also help co-found the Data Science for Public Good program at my university. And so here we bring students through. And so this question about how to train students, I think, is even because we're switching. And we co-host, there's a DSPG track, Data Science for Public Good track within the Midwest Big Data Hub Summer School, which I'm shouting out because Nebraska sends people every year, like big contingents of folks come to that to go through training. And so this has always been a question. R has been a huge part of the training for people to learn how to do this. We've started teaching Tableau classes every year, and the Tableau is also being taught to the students. But our community groups are asking for free things. And so we've developed resources around QGIS as well, which is a free system. But if I just had to put I can't choose what I like, but I think Tableau works really easily. If you have the money, Tableau is great. We do use ArcGIS too. It's wonderful. But we're always happy when people ask for things in Tableau. But R and QGIS are free, if that matters.
And that's why a lot of people I tell, just use Excel if you're just doing static data, you have it already. Bryce, but I want to ask you about trade-offs, right? How do you strike the right balance, particularly for your users, about providing them all of the data they could possibly need, and then making sure it also turns into impact? And you have a really specific group of folks you work with as those users too. So how do you help them to think about what do you need and what do we have?
Yeah. So, I think I helped kind of strike the balance of what do you need versus what do we have when consulting with initial stakeholders on the development of the dashboard at Economic Development Council of Colorado's annual meeting, and meeting with rural economic developers on the data that they kind of particularly try to look for. And so when I structured especially a lot of those introductory pages into the rural data dashboard, all of that balance is kept in mind of not trying to overwhelm them with data, because there's a lot of data in there still. And a lot of it, comes from those quarterly workforce indicators into filtered views. So to help trying to strike that balance of it hopefully not being too daunting, I just say kind of the first 3 pages of the dashboard house a lot of the more varied information. And then towards the tail end is where you can get a little bit more tailored in that industry employment questions that you could be having, so that it doesn't feel too overwhelming for the lay individual to get into. And then also, if it's not in there, through those bi-weekly data office hours I hold, I also can kind of help point them in the right direction for sometimes when I'll get emails and questions to me of,
I want to say thank you so much to this panel for your insights, for your expertise, for the work you're doing to help people in our state and around our state. So that is wonderful. Thank you. To all of the folks out there, thank you so much for being with us this morning. We hope you will come back for part 2. Thank you all so much. And we will hopefully see many of you back in September. Thank you.